Na temeljih evropske tradicije, zapuščine Paracelsusa, Enderleina, Steinerja, Fishingerja in drugih, se je v zadnjih 50 letih razvil napreden, celovit medicinski sistem, tako imenovana biološka medicina. Uradna medicina se običajno ukvarja z boleznjo in simptomatičnim pristopom terapij z zdravili, medtem ko se biološka medicina ukvarja s človekom kot celoto. Celovito obravnava posameznika, njegovo življenjsko okolje in navade in odkriva najgloblje vzroke, ki so privedli do neravnovesja in bolezni. Preučuje tudi celični nivo našega delovanja, odpravlja vzroke in vzpodbuja notranje regulativne procese, ki aktivirajo zdravljenje. Kadar je potrebno, vključijo tudi uradno medicino. Kako uspešna je biološka medicina, dokazuje klinika Paracelsus v Švici, ki je običajno zadnja postaja tistih, nad katerimi so drugje dvignili roke. Slednji v veliki večini kliniko zapuščajo ozdravljeni. Uspešnost zdravljenja bolezenskih stanj, za katere uradna medicina nima pravih rešitev, je pri njih izjemno visoka. Kaj je biološka medicina? Kako deluje in pri katerih zdravstvenih težavah je še posebej dragocena, se verjetno sprašujete. Vse to nam bo v današnjem pogovoru pojasnil profesor dr. Thomas Rau, oče sodobne biološke medicine in dolgoletni strokovni direktor največje in najuspešnejše holistične klinike v Evropi. Professor Dr. Thomas Rau, warmly welcome in Slovenia.
Thank you.
This is the first interview for Slovenian audience. So you started your professional career as medical doctor, rheumatologist, right?
Yes.
And now you are one of the most prominent biological medicine doctors in the world. And I wonder when or why did you step on the path of biological medicine?
Doing biological medicine learning is a long-term process. It's a lifelong process. You have to switch your brain. You have to really come from a totally different approach. So this is, I didn't switch like this. The reason was that in my patients, which I had as mainly rheumatological patients or internal medicine patients, they just were not successful. They have done all the medication, all the orthodox treatment, and they didn't really get better. They needed medication all the time. And so then some of them, they came and they said, "Oh, Dr. Rau, I did this and this." And, well, what did you do? "Oh, I did deacidification, alkalinization, or I began to take supplements." "What did you do?" "Dear, where did you do?" "Oh, Dr. So-and-so in Salzburg or in wherever I went to." Then I called Dr. So-and-so in Salzburg. "What did you do on my patients? He got better and I didn't get him better for 3 years." "Oh, I did deacidification, I changed his diet, and so." And then I said, "Well, can I come to look?" And this is the difference. You have to be open-minded, big ears, big eyes, open-minded. And that's what I did. So more and more I integrated step by step other techniques. Right. And the patients got better.
So how would you describe maybe the most important or the main benefits of biological medicine for patients?
It integrates the patients themselves. I need patients who help for their healing. So I show them what to do now. 30 years later or 35 years later, I know exactly what the patient needs, which kind of diet, change of nutrition, or also trace elements and so on. The patient with undefinable or chronic disease can be healed. It's much, much, much more effective than orthodox medicine.
Yes, and I believe your healing approach is pretty much unique. At the seminar in Ljubljana, you were talking about 3 pillars by Dr. Rau. Can you tell us a little bit more?
Yes, well, 3 pillars by Professor Rao. This sounds so unique, but it's simple. Okay. I just looked at what are the main reasons why patients get so sick and undefinable chronic diseases. It's toxicity, it's the lack of immune system, especially in cancer, and they do not have the forces, the life forces anymore to rebuild when they are degenerative. They can't get up. And we provide detoxification, immune treatment, and rebuilding treatments. This is the 3 pillars.
Okay, because biological medicine always treats causes that lead to disease,
Yes.
right? And which diagnostic methods do you use to find these real causes?
We have, first of all, I am one of the few doctors who still examine the patient. And I examine every patient, so I have this kind of clinical feeling. This is the most important. I do this since 30 years, every day. So I can examine. Then we have blood tests, but blood tests which show the immune system, or blood and urine tests and saliva tests which show the toxic load. And also we have possibilities to test in blood, saliva, urine about the trace elements. And I see, oops, our patients nowadays, they no more have the needed essential amino acids, the needed trace elements, and we replace, and then they get better.
Okay, and there are many different therapies available at Paracelsus Clinic. And why is it important to include and combine different therapies in order to succeed?
I like this question, because the patients always think, we go to the magic doctor and he gives the pill and then it's okay. This is not the case. If you have a, let's say, autoimmune disease, this patient has autoimmune, and the third patient, you have different reasons, different causes. And we need, and there is never one cause, it's always several parts. It's like a mosaic. And according to what mosaic you have, you need different modules. So we build up if you have a lack of trace elements. Or we detoxify if you have a toxic phenomenon. Or if the immune system is broken together in cancer patients, we have to do these. And then we have very specific treatment for cancer patients.
Okay. And at Paracelsus Clinic, you successfully treat the patients with health conditions where orthodox medicine cannot find any effective solutions. You already mentioned what are the most common diagnoses of your patients coming to you?
60% of my patients are cancer patients. And they were, unfortunately, more or less all of them, they have been unsuccessful. They were chemotherapy, operation, radiation, chemo again, and they reoccur all the time. So we get these stage 3 or stage 4 cancer patients. So this is 60%. Then the other 40% are chronic, unclear diseases like multiple sclerosis, like ulcerative colitis, like Crohn's disease, like Lyme disease gets very, very frequent now. And these kind of diseases, and my patients, they have all of them, they were on orthodox treatment. Some come with such piles of documents from Mayo Clinic, from Houston, Texas, from Bangkok, from London, from everywhere, and they were not helped. So they need a different approach to their disease. And this is what we provide.
You mentioned Lyme disease, and you know Slovenia is among countries with highest threats of tick bite. And so the tick-borne meningitis and especially Lyme disease are quite common problems here in Slovenia. But you said you can successfully treat Lyme disease?
It's not only Slovenia, it's also Switzerland. When I look here, beautiful Slovenia. Why is it so beautiful? Because it's like Switzerland.
Okay.
So, but we have exactly the same problem too. We have this humidity, we have the forests, we have the deer who are carrier of ticks. So we have so many tick bites, so many. But and then they go to have their conventional treatment and they get worse and worse and worse. Because Borrelia, once in the body, reoccurs. You can't eradicate. So we approach differently on Lyme disease. It sounds very arrogant now, but we have 100% success. The patients who come to me, they get healed. Lyme is really diagnosis. Please send them to us, because we really are successful. This is a question of toxic load, a question of co-infections from viruses, and a question of the immune system. And if we treat these three things, the body manages the Lyme bacteria, Borrelia burgdorferi, by itself. So why have ticks? When I was a little boy, we had ticks. Our dogs had ticks every day. Why did we not get sick? Because we didn't have all these other viruses, because we had a different immune system, because of different nutrition. It was what we call the inner milieu was so different.
Oh, so now you mentioned really we have now everything is modern lifestyle, modern technology, but it seems like people, as you mentioned, are not really very healthy. They more probably, what do you think? Why?
People get less and less healthy. It's interesting, nobody talks officially about in USA the life expectancy, which increased, fantastic. It decreases. If you are a 50-year-old person in the US, you have about 8 years less life expectancy than you had 20 years ago. It changed because of all these new diseases which are based on horrible lifestyle or electromagnetic load and all these influences which interfere with your health. We have new diseases. When I was learning internal medicine, I did not know about Hashimoto's. I did not know about Lyme disease. I did not know about leakiness of the gut. And now these are the very frequent diseases. We have to change our approach. We have to change the lifestyle, but also do these things which are nowadays weak. Immune system, internal milieu, acid-base situation of the body, bacteria in your intestines, these things which matter now. The microbiome, the integrity of the intestines, the toxic load. These are the things. 30 years ago, this was not a topic.
And of course, many years ago, autism was not the topic. And now we see a lot of children with autism. And what do you think about that? And do you have maybe successful treatment for those children?
We have a lot of autistic children. It's really a drama, especially from China and from the United States. We have many, many autistic children. And it's increasing in number, as I said in the seminar today. And it will be one of the big social, economical, but also medical problems. In New York, they expect in 10 years, 10% of all the school children will be compromised. They will have to make extra schools for them. It's an unexpectable undefinable risk for economics and for social system. Autism. What is behind? Autism is a multi-level disease. Always toxic, always viral backgrounds, very often other backgrounds, which I can't talk now about, and electromagnetic load. It's really multi-level, and if we approach these children, we have very good success. I can't say I heal autism. It's a long-term process, and the patient has to be integrated. The family has to be integrated. There is not the autism pill. It does not exist.
But it's so inspiring to hear so many stories of successfully healed patients. According to your experience, what contributes most to the final success?
Nutrition. The change of nutrition, which is very individualized. Nutrition changes the acid-base metabolism. Nutrition changes the trace element level of the patient. Nutrition significantly influences the immune system. So without an individualized change of nutrition or adaptation of nutrition, you are not successful on the modern unclear diseases.
Yeah,
so this is the most important factor. And then, of course, it is the upbuilding of the intestines. This is why we have these phenomenal preparations, developed these phenomenal, unique preparations for the intestinal health and for the detoxification. Toxins begin in the intestines, and we have to bind them there.
What about the role of a patient himself in the process of healing?
I ask my patients, you have to help me, and if you help, we have a success case. If you do not help and not cooperate, then please go to another doctor. This is what is so important. I tell them what to do. They can't stay in my clinic for a year. They stay for 2 weeks, and I can tell them exactly what to change. In 3 to 6 months, they can come again, and then we can fine-tune the radio, so to say, and to adapt. But they have to integrate themselves, take our upbuilding remedies, do the change in their lifestyle, normally nutrition. But the interesting factor is, no, I can't do this. And then I say, well, either you do or you go to another doctor, and they do it. And after 3 weeks, after 2 months, they say, oh, I'm a new person. I can sleep, I have no more headache, I see better. But they came for arthritis, as an example.
Okay, now maybe we should say just something, maybe a short general health advice for our audience. What would you recommend them in order to stay healthy as long as possible?
This is a very individual question. Normally, again, eat and live healthy, but everybody says this. And we can adapt, very individualized. Secondly, take at least for several months our supplements which go to the root of your disease, and until you are on another health level, and then you can maintain this health level by nutrition, mainly nutrition. But it needs, if I would say, oh, you just eat so and so, then it would take too long for an arthritis or an MS patient. So we give the medication, and which they can take for several months. These are examples of medication, but it's only some of the important ones. Okay. But long term, the patient doesn't need medication if they really follow the advices.
Thank you very much, Professor Dr. Rao. It's been a pleasure talking to you.
Also. Thank you very much. And again, chronic diseases, this is what I want to give to the people who look your television show. Chronic diseases, unhealable diseases, are no more unhealable today when you approach the causes. And this is what biological medicine applies and provides.
Great. Thank you very much again.